My name is Alon Entebbe. I'm an orthopedic surgeon. I've been saying it since I was 5 years old that I want to be a doctor. I never knew that I wanted to be an orthopedic surgeon until I actually started medical school and had some exposure. But I've always had this yearning to want to help people. After 4 years of medical school, I moved to Michigan, and that's where I did my orthopedic surgery residency, and that was a 5-year residency. After that, I wanted to subspecialize in orthopedic trauma and then moved down to Tampa General Hospital where I did a 1-year extra year of training, which is orthopedic trauma training. Most orthopedic surgeons, when they come out of training, they usually go find a job with some kind of group. I didn't want to do that. I wanted to start my own practice, and now I'm involved with a group which is a multi-specialty group, all within the spectrum of musculoskeletal care. And as soon as I did, 1 week of orthopedic exposure, I'm like, this is it. This is what I want to do. And I say it all the time. If it wasn't for orthopedic medicine, I would not be in medicine. This is the only thing I was born to do.
My name's Jim. I was having hip problems. I did my research before I got Dr. Entebbe, and he was so well spoken of by doctors, nurses, and I was so impressed by looking him up on the internet and everything. He's really brought the big city up to the Antelope Valley and the quality of doctors that we have here. I think he's one of those guys that he's just on top of his game, and that if you get a chance to have hip surgery done or knee or elbow, whatever you're going to have done by Dr. Entebbe, that you're going to be so pleased that you've got one of the best.
The anterior approach is a minimally invasive approach to the hip for a total hip replacement. When somebody has a traditional hip replacement, they would have to go either through the gluteus maximus, which is the largest muscle in your body, or the lateral approach, which is through the big tendon of the hip, and that is just more disabling. When you cut the major structures of the hip, it just causes more postoperative pain and limp and disability. So the direct anterior approach is actually a true minimally invasive approach. You're not cutting any muscle, you're moving muscle out of the way to get into the hip joint. And I've perfected it now where it's now being done through anywhere between a 2.5 to a 3.5 inch incision. Most of my patients go home the next day. I've had several patients actually go home the same day after surgery. After a traditional hip replacement, you will have limitations as to what you can and cannot do in regards to bending over, keeping your feet crossed, keeping your feet open. There's all these restrictions as to what you can and cannot do, especially in the first 2 to 3 months after surgery. With the anterior approach, there's absolutely no restriction. You can do whatever you would like without fail.
My name's Larry. I've had 2 shoulder surgeries, I've had 2 hip replacements, and Dr. Entebbe is about to do a knee surgery on me. I ride a motorcycle, have for 40 years, and it got to the point where I couldn't sit on my bike for more than 10 minutes. And this is for the hips. And now I can go 300 or 400 miles, before I get tired. And my hips don't hurt. It's just the quality of life that I have now is 100% better. I mean, he's amazing with the procedures that he does. He's what I would call a breakthrough doctor. He tries new things. And I had a friend that had the same hip surgery, but they used the old method, and he didn't get out of bed for 3 months. And I got out of bed within hours after. I never thought that I would be as lucky as I am, to have these surgeries and have a doctor like him.
Non-surgical options for arthritic joints include, one, most important, is education. Number 2 is providing them medication if they're not taking the right medication, physical therapy, and bracing. These are all non-surgical modalities. The other things that we offer are what we call platelet-rich plasma protein. It's PRP. This is what the stars are doing, the athletes are doing, injecting their tendons, injecting their arthritic joints or their worn out joints to try to help their pain. It's not a panacea, and it's definitely not a holy grail, but it's just another modality that we can help patients before they undergo a surgery. But when somebody has a severely arthritic joint that they lived with for so long, surgery is usually the only answer unless they are just willing to just live with their pain, limp, and just keep taking pills to try to subside their pain.
My name is Louise Wooden, and I had both total knee replacements. I was on a walker for about 8 years, and when I came in here that day, I was exhausted. And from the day that I came in, which was August 2013, a lot of things has changed in my life because of the knee replacements. I knew what I needed to have done, and he told me the truth, and I liked that because it made me see myself in a different aspect. Now everything is looking up right because I walked the first time without support in the last 8 years. So that has got me very excited.
Off-roading is a very popular sport with dirt bikes and motorcycles and quads, and unfortunately people sustain a lot of injuries from those. One of the things that I specialize is orthopedic trauma, and unfortunately a lot of times they end up with complex injuries such as pelvis fractures, acetabulum fractures, as well as complex articular injuries involving the ankle joint or the knee joint or the hip joint. And those require specialized hands for those types of surgeries. With my orthopedic trauma fellowship training, I'm pretty much the only orthopedic surgeon in the Antelope Valley, Santa Clarita Valley, and the entire San Fernando Valley that does these complex pelvis and the acetabulum fractures. Hospitals refer patients to me from various facilities. I get patients transferred in from Henry Mayo Hospital that will go to Holy Cross, or from Northridge Hospital that will come to Holy Cross. In the entire Antelope Valley, we have 2 hospitals that I'm the only surgeon that does those procedures there as well. I specialize in orthopedic trauma as well as joint reconstruction, which includes hip replacement, knee replacements, and shoulder replacements. As an orthopedic surgeon, I provide care to a lot of patients. When I see a person in the office, I try to give him my individualized attention. I'm not sitting behind a computer or taking notes. I'm looking you straight in the eye, finding out why you're here, and coming up with a solution. I'm here to tell you the truth as to what is wrong with you and what could be done to fix you. When somebody comes in for a professional opinion because they need a joint replacement, in my opinion, you need to see the surgeon, not the person who's going to be, teeing you up to see the surgeon. You need to see the surgeon. When you come and see me in my office, you are seeing me. What separates me from most orthopedic surgeons is my background in the training that I've done. I specialize in orthopedic trauma and joint reconstruction. I am board certified and fellowship trained in orthopedic trauma. The level of care and the level of expertise that I provide for patients is second to none. My work speaks for itself. I love to take care of patients, and the gratification that I get from taking care of patients and seeing the immediate results that you get with orthopedic care is unlike any other profession, in my opinion. I have compilations of cards and letters that I get personally from patients from treating them, and it's an amazing feeling when you have that impact on somebody's life. That's how you know you're doing a good job. It's taking care of people and getting good results.
My name is Ron, and I came in for a hip replacement. I did my initial consultation with him. He's done an outstanding job with his explanation of what the problem was. Outstanding job explaining the process of going through the surgery and what the recovery time would be and what to expect during the recovery time. My life is completely different right now. The pain that I was experiencing prior to the surgery, which was within the hip area, completely gone. Definitely more mobile, and another 4 to 6 weeks should be completely pain-free as the surgery pain slowly dissipates. I would recommend Dr. Entebbe hands down, no question at all. As far as recommending him, I give him 5 stars. If I could give him 10, I'd give him 10 stars. I mean, he definitely knows what he's doing, very experienced, and that comes out in his surgeries, it comes out in his bedside manners, and when you sit down and have a conversation with them, both pre and post surgery.
One of the most common procedures that I perform are joint replacement, hip replacement, knee replacement, as well as shoulder replacement. When somebody comes in with joint pain, we want to first make sure the diagnosis is correct, and that would involve some imaging, getting x-rays, possibly an MRI, maybe a CAT scan, and then doing a physical exam to come up with a diagnosis. Once a diagnosis is made, and in the history, and taking the history from the patient, we want to see how long the patient's been in pain, what has been done for them before. Some patients have had everything done outside of surgery before coming to my office, and they come seeking surgery, but some patients have really had nothing done, maybe taken a Tylenol or an Aleve over the counter. A lot of times it's information, a lot of times it's conservative treatment with injections, medications, physical therapy, bracing. But some patients come to the office, they've been living with pain for years and they just can't take it anymore. And at that point, they're ready for surgery.